Happy Saturday, Miss Charity. Alethea here. I hope all is well. I wanted to tell you what great points you made in your video discussion post this week regarding patient-centeredness. You mentioned the cultural aspects of care, which I believe to be more significant than we tend to acknowledge. You mentioned the educational aspect of patient-centeredness, which is a large part of what we do during patient interactions. We are constantly educating on medications, procedures, illness, disease processes. You also briefly touched upon how patient-centeredness is something that the government has essentially made a focal point in regard to reimbursement with the Affordable Care Act. Reimbursement is not only contingent upon patient outcomes, right? So we know that the largest healthcare payer in the United States is the federal government. Medicare, Medicaid, United Healthcare Group. And for this reason, in 2010, during the largest healthcare reform in history, the United States government had to remodel the current billing systems because this was a problem. Unfortunately, healthcare providers were overspending, overcharging for services, supplies, medications, making it difficult for the government to create or fund a culture of inclusivity, equality in regard to who has access to healthcare. Then came value-based purchasing, which is what I wanted to add to your discussion post this week. This program was implemented by the Centers for Medicare and Medicaid Services, CMS. It was coupled with the Patient Protection and Affordable Care Act of 2010 to set the standard for quality care by incentivizing hospitals with incentive payments to improve care delivery. The expectation was no longer to rely on the hospitals to report performance or quality measures because this could easily be distorted, but to set forth a new standard of including the voice of the consumer. This program allows patients to speak about and report, make known their own healthcare experiences, making it patient-centered. CMS 2024 reports that the HCAHPS, Hospital Consumer Assessment of Healthcare Providers and Systems, their surveys ask patients about their stays. Questions like, during your hospital stay, how often did your nurse or doctor treat you with courtesy and respect? How often did they explain things in a way that you understood? How often did you hit your call light that it was answered as quickly as you needed it to be? How often was your pain controlled? All of these questions are centered around the patient, making them patient-centered. These services, these types of services empower patients to have a voice, to participate in care, which ultimately improves the culture of health services. I hope that I provided some new information this week, and as always, I wish you well. Thanks for your contribution this week.